GHHS is a national honor society that recognizes humanism in medicine and compassionate patient care. Third-year medical students are inducted into this honor society and are chosen based on a peer nomination process where the students' classmates recognize them as people that give compassionate patient care and who they would like to take care of their loved ones.
GHHS is an honor society on campus that is focused on compassionate care for patients and really developing the skills that not just make people, good diagnosticians or good clinicians, but really good caregivers.
Sunday Rounds is a program that Gold Humanism started, and we take first and second year medical students over to the hospital one Sunday a month and visit patients on the solid organ transplant unit and the adult progressive care unit. These are purely social visits. We just kind of get to know them as people and not as patients, and have conversations with them, and it's a great opportunity for us to get more comfortable talking to our patients and to learn a little bit from them in a non-medical sense.
For burnout dinners, usually like to start the night with a favorite quote. It's, "Tension is being who you think you should be, and relaxation is being who you are." And tension, by that definition, happens a lot in medical school, and burnout dinners are an opportunity to relax and be who you are in the given moment, which can be disconnected, maybe frustrated or stressed out. But the goal of the burnout dinners is to not just acknowledge that, but also to try and bring things back to the fire that really brought people into medicine.
The Burnout Club is a writing group that meets on Friday afternoons with Dr. Bud Shaw, who was one of the founders of the liver transplant program here. And the way it works is that Dr. Shaw will bring a prompt, and then we'll all just sit and write, maybe for about 10 minutes, and then stop and discuss.
The goal of the Burnout Club is that we are trying to give students an avenue to kind of either cope with stress of being in medical school, a way to vent to their peers and do a little introspection.
From any given prompt, you might have a couple people who go off on a short piece of fiction, or a couple people who write about something that's happened to them in clinic, or a couple people who write about something that has nothing to do with medical school at all, but is still from their life experiences.
As part of Solidarity Week, we do the Tell Me More campaign. This is a campaign where we fill out these oversized Post-its with our patients and ask them 4 different questions. So the questions that we asked this year are, what are your hobbies? What's your favorite place that you've ever been? What talent or skill do you have that gives you the greatest sense of pride? And what piece of advice have you tried to live your life by? So we fill these cards out with the patients and hang them up in their rooms as a way for nursing staff and all members of the healthcare team to kind of get to know their patients a little bit better, and hopefully spark some non-medical conversation with our patients. One other activity that we do as a group is called Group Hug, which stands for Help Us Go Gold. And GHHS members host lunch for first and second year students respectively, and just kind of help them through the burnout and the kind of the monotony of the first couple years of medical school.
GHHS is all about the part of patient interaction that is going off script. We have a lot of information to gather when we're talking with patients, but it's that extra part that's really interested in the person beyond the patient.
We are very grateful to the UNMC campus for their support of the Gold Humanism Honors Society and for allowing us to influence both patient and student lives on campus. We are really excited for the future and look forward to expanding our presence on campus.